Welcome back. This is Dr. Jamie Motley, and I will be covering a standard radiographic examination of the hand. Standard projections of the hand include PA hand, medial oblique hand, and lateral hand. There are multiple accessory projections that we will not discuss in this tutorial. However, they are very useful for evaluating anatomy that is not well seen or even pathology that needs further evaluation. Let's begin with some normal anatomy. Beginning in the wrist, this is the ulna. I'm just going to change my color here. I don't know how well black is going to show up. Here is the ulnar styloid. This is this stylus-like region, and again the rest of the ulna. Now remember, in hand projections, we're only going to get a variable amount of the radius and ulna. Typically, the first inch or two of the ulna and radius will be included in hand projections simply to evaluate the radiocarpal joint and the distal radial ulnar joint. Here's the radius. Here is the radial styloid, this styloid-like region here. Next, the joint made between the radius and ulna that you see in the wrist is the distal radial ulnar joint. It's important to say distal because there is a proximal radial ulnar joint. Here is the radiocarpal articulation between the distal radius and the carpal bones. They call this shared radiocarpal joint space. These are the carpals. Now, the proximal row of the carpals is here. This is the proximal row. Proximal row has 4 bones. Distal row here, which articulates with the metacarpals, has 4 bones as well. Let's start with the proximal row. Here is the scaphoid. Now the scaphoid is a very important bone and should be paid close attention to because this is the most common carpal to fracture. Typically the fractures in this location will occur by what we call fouche injuries, also known as falling on an outstretched hand. So any type of activities in which a person may fall and want to break their fall using their hand, this particular bone is very susceptible to fracture in those types of mechanisms of injury. Now we want to pay very close attention to the waist because the waist is the most common location, or the midsection of the scaphoid. This is the most common location where fractures will occur in the scaphoid. Now moving on to the next carpal is going to be the lunate. Now this name will become important in just a moment when we get to the lateral projection, because on lateral projections it does look very much like a crescent moon, hence the name lunar or lunate. So scaphoid, lunate. Now these 2 bones here are going to be sitting on top of each other. The bigger of which is going to be the triquetrum, and the smaller, rounder one of which is the pisiform. Now the pisiform is technically a sesamoid bone and does live in a tendon. Overlap of the pisiform and the triquetrum is very, very common on PA radiographs. Now we come to the distal row. The first bone, which articulates with the first metacarpal, is going to be the trapezium. Second bone, which is trapped between the trapezium and the capitate, is going to be the trapezoid. Next, capitate, and lastly the hamate. So we have outlined our 8 carpals. Moving on, these articulations are the carpo-metacarpal joints. They are between the carpals, which we just discussed, and the metacarpals. Now, the common joint between them, again, is called the carpo-metacarpal joint. Now the metacarpals, there are 5, have 3 distinct areas that we like to discuss. The base, which is in the region of the carpo-metacarpal joint. There's also the shaft, which is the midsection or the thinner section of the metacarpal. And we have the metacarpal head, which is slightly rounded. It is normal to have these small indentations along the metacarpal heads. The metacarpal heads articulate with the proximal phalanx. Now the term phalanx or digit is also used to describe the whole finger. So if you say the first phalanx or the first digit or the first finger, or which would be the second in this case, second finger or second digit. Collectively, the 3 phalanxes comprise a single digit. Now, in digits 1 through 5, you have 3 phalanxes. You will have the proximal, you will have the middle, and you will have the distal phalanx. This is true again for the second through fifth digits. If we draw our attention to the thumb, you'll notice that there is only a distal and proximal phalanx. Therefore, there will be one less joint in the thumb. Notice here, there's an interphalangeal joint between the phalanxes. This is an interphalangeal joint. If you notice on the second through fifth digits, there are two joints along the digit. This will be the proximal interphalangeal joint, while this is the distal interphalangeal joint. This is an important thing to note simply because the digits 2 through 5 have three phalanxes and therefore two joints between them. Now, the distal phalanx has a very pronounced feature, is semi-bulbous in appearance, and this is the distal tuft. Now, this region can become important in certain conditions that can cause resorption of the bone directly under the tips of the fingers. The differential diagnosis is quite long, and once we get into differential possibilities, we'll talk a little bit more about that. These are sesamoid bones, these little small bones that you can see both in the hands and feet. Again, sesamoids are within tendinous structures and typically are going to occur at the fulcrum of a joint. There's another region that I wanted to talk to you about in the wrist, and this area is reserved for the triangular fibrocartilage. And fibrocartilage is not radiographically visible, but is still present. The reason why I'm discussing this region is because oftentimes students want to say that there is a ulnocarpal joint, and that's not necessarily true. This triangular fibrocartilage lives in this region and essentially cushions the space between the ulna and the carpals. So the radiocarpal articulation is the articulation that we really talk about, as it does have hyaline cartilage and is a typical normal joint space. Here is the medial oblique projection of the right hand. The anatomy that's visualized on the PA projection is still visualized on the oblique projection. However, we get a slightly different orientation. You'll notice now that we can see the ventral portions of the metacarpals and phalanges. Notice we can see the more ventral portions of the metacarpals. Here's the distal interphalangeal joint, which makes this the distal phalanx, middle phalanx, proximal interphalangeal joint, proximal phalanx, metacarpal phalangeal joint, carpal metacarpal articulation, of course the metacarpals, interphalangeal joint of the thumb, metacarpal phalangeal joint of the thumb, and again carpo-metacarpal joint. Again, carpals, scaphoid, lunate, triquetrum, and pisiform. Distal row, trapezium, trapezoid, capitate, hamate. And the hamate has this nice little hook here. Ulna, ulnar styloid, radial styloid, radiocarpal joint. Now we will move on to the lateral projection. We are now looking at the lateral projection. Let's start again with the bones of the wrist. Ulna, ulnar styloid, radius, radiostyloid, lunate. Here is where we see the very nice lunar shape of the lunate. Now the lunate is going to stand out for you. It's going to be the first bone you see that's semilunar in shape, sitting directly on top of the radius. The rest gets a little more complicated. Here's the scaphoid. We can only really see this portion of it without much overlap from the other carpals. What you see back here is actually the triquetrum. And on lateral projections, you oftentimes with triquetral fractures will see a little flake back here. Triquetral fractures, also known as Fisher's fractures, is just a fracture of the triquetrum, and typically you'll see the fragment in this location. So lateral projections can be very useful for that. We can also see a portion of the trapezium. We don't see much of the trapezoid, and the capitate sits directly on top of the lunate, and that's about as good as we're going to get. We don't see the pisiform very well. We don't see the hamate very well, and so you have to use your other radiographic projections to help you identify those structures. Now, as you can see, all the digits as well as all of the metacarpals are stacked on top of each other. So this is not a great view to see them individually. However, with any type of forward or backward displacement or angulation of fractures, this view can be very useful to evaluate direction. Also, if you're concerned about volar plate or dorsal plate fractures of the phalanxes, this also is a useful. You can also separate the fingers while taking this view and kind of fan them out so you can see the digits individually in a lateral perspective as well. Now the thumb, since it kind of lays off to the side, we can identify those structures. This is the metacarpal. Here is the proximal phalanx. Sorry, I'm getting a little messy here, and distal phalanx, but you're familiar with this anatomy now, so you know exactly what I'm pointing to. Here is the interphalangeal joint of the thumb and the metacarpal phalangeal joint of the thumb. There is a little sesamoid bone. We saw it on the other projection. It's okay. We also want to make sure that there's no ligamentous or tendinous calcifications or soft tissue calcifications within this region. I hope this tutorial was useful, and please join us again for future tutorials.